All right, thank you, Jen. Well, lots of celebrations are going on all this week at upstate Golisano Children's Hospital because it is the 10th birthday of the Syracuse Medical Facility.
Carrie Lazarus is sitting down for the conversation with the physician in charge.
Dr. Gregory Connors, thanks for having us in one of the many playrooms here at Golisano Children's Hospital.
Well, it's great to have you here.
Now, you're pretty new to the hospital. You only arrived here in the spring. You came along at a very exciting time.
It's been very exciting getting ready for the 10th birthday, thinking about and learning about what's been going on here for the previous 10 years and how it all has come together, and learning about the Syracuse community.
What has it meant for this community to have a children's hospital?
Well, having a children's hospital really is a reflection on the greater community. So it's a medical thing, but also it's part of the arts and the culture and everything else that makes a city like Syracuse as special as it is. Particularly regarding children, though, you know, and the health care for children, we've been able to recruit through these wonderful facilities really a wide variety of specialists for kids that we never probably could have otherwise. All kinds of specialists in children's kidneys and surgeons and all kinds of things. And it really allows us to keep families here in town to get complex, and sometimes not so complex, but to get complex medical care that maybe they would have had to go to some other city for in the past. It's made a big difference to the lives of children.
What are some of the things that you would like to see built upon as you move ahead to the next 10 years?
Sure. That's something I think about every day. What can we do better and bigger? I mentioned bigger because, as I said, we've been able to retain so many kids in the area who need specialized and advanced care. And in some ways, we've been too good. We are full or almost full a lot of the time in the inpatient floors. So we really need to grow the inpatient facility. So
you
that we
mentioned
can
you have 71 beds and 68 of them right now are full.
Yeah, you know, when you start to get that full, and we often are, you start to sometimes have to turn kids away, and we don't want to ever have to do that. So
one of the increased demands is for mental health care. Do you have plans to expand the kind of care, not just in the hospital, but outside?
Yeah, so you're right. We see kids, teenagers, and then younger and younger these days, who are in acute mental health crisis, depression, anxiety, suicidality, and all other things, aspects of mental health care too. So it's quite a challenge. We see them in the emergency department and other places. So yeah, we're trying to meet that challenge by increasing our inpatient facilities for mental health for teens, our outpatient facilities, and to grow our ability to care for these kids.
So you're a Rochester native.
Yeah.
So you're really not that far from home. But I want to ask you, now that you are out recruiting doctors to come to Central New York, what's the sell?
So yeah, I'm from Rochester, and I feel lucky to be so close to my many family members who are in Rochester. But I'm a Syracuse guy now, and the sell for Syracuse is that, well, we start with the Children's Hospital. It's a wonderful facility, and actually, to tell you the truth, a lot of kids like being here. It's hard to believe that kids like being in the hospital, but it's an attractive, fun place. Probably the most important is the colleagues. People work someplace where they have good people to work with. And we have such an enthusiastic and collegial, and I want to give a whole bunch of other phrases to describe how wonderful our faculty are. And really, it's a tribute to the people who've worked here before me, and I'm trying to continue this of having wonderful people here to take care of the kids.
Well, we're glad you're here.
Thanks.
Happy birthday, congratulations, and we look forward to see what you do in the future.
Well, thanks.
Dr. Connors may be the physician in charge at Golisano, but his passion is still emergency medicine, and he can be found working one shift a week in the ER at the Children's Hospital.
A very busy man. Still